Hi, and welcome to today's Daily Chronicle. Today's Friday, January 3rd, 2025. Louisiana forbids public health workers from promoting COVID, flu, and Mpox shots. A group of high-level managers at the Louisiana Department of Health walked into November 14th meeting in Baton Rouge, expecting to talk about outreach and community events. Instead, they were told by an assistant secretary in the department and other official the department leadership had a new policy. Advertising or otherwise promoting the COVID, influenza, or Mpox vaccines, an established practice here, and at most other public entities in the U.S., must stop. NPR has confirmed the policy was discussed at this meeting and at two other meetings held within the Department's Office of Public Health on October 3rd and November 21st through interviews with 4 employees at the Department of Health, which employs more than 6,500 people and is the state's largest agency. According to the employees who spoke on the condition of anonymity because their fear of losing their jobs or other forms of retaliation, the police would be implemented quietly and would not be put in writing. Staffers were also told that it applies to every aspect of the health department's work. Employees could not send out press releases, give interviews, hold vaccine events, give presentations, or create social media posts encouraging the public to get the vaccines. They also could not put up signs at the department's clinic that COVID, flu, or Mpox vaccines were available on site. The new policy in Louisiana was implemented as some politicians have promoted false information about vaccines. And President-elect Donald Trump seeks to have anti-vaccine activist Robert F. Kennedy Jr. lead the U.S. Department of Health and Human Services. And some public health experts are concerned that if the other states follow Louisiana, the U.S. could face rising levels of disease and further erosion of trust in the nation's public health infrastructure. At December 16th news conference, Trump addressed ongoing concerns about Kennedy's nomination and whether it could lead to significant changes in national vaccine policy. Trump said that Kennedy will be much less radical than you would think. And that he has a very open mind. Trump also called himself a big believer in the polio vaccine and said, "You're not going to lose the polio vaccine." A blow to public health practice. Staff at Louisiana Health Department fear the new policy undermines their efforts to protect the public and violates the fundamental mission of public health to prevent illness and disease by following the science. I mean, do they want to dismantle public health? One employee at the health department said. "We're really talking about deaths," said another. "Even a reduction in flu and COVID vaccines can lead to increased deaths." Governor Jeff Landry's office referred questions to the Louisiana Department of Health and did not respond when asked if Landry supports the changes. In a statement, The Louisiana Department of Health told NPR it has been reevaluating the state's public health priorities as well as our messaging around vaccine promotion, especially for COVID-19 and influenza. The statement described the movie as a shift away from one-size-fits-all paternalistic guidance to a stance in which immunization for any vaccine, along with practices like mask wearing and social distancing, are an individual's personal choice. The statement did not address Mpox vaccinations. The statement said that the flu vaccine can reduce illness severity and therefore may help high-risk patients, but falsely claimed the flu vaccine does not prevent one from getting the influenza virus. According to Centers for Disease Control and Prevention, the vaccine reduces the risk of getting the flu. Experts fear consequences of undermining trust in vaccine. Last year, 652 people in Louisiana died of COVID, including 5 children. Louisiana currently is tied with D.C. for the highest rate of flu in the U.S. in 2022. Alone, flu killed 586 people in Louisiana. Every health department staff member, former staff member, public health official, and vaccine expert contacted by NPR repeated the scientific consensus that vaccines are safe, effective, and essential for preventing illness and hospitalization and deaths. It's a step backwards, said Kimberly Hood, who led the Office of Public Health, a subunit of the Health Department from 2021 to 2022. It's a medical marvel that we're fortunate enough to live in a time where these vaccines are available to us, and to not make use of that tool is unconscionable. The policy rises at the level of absurdity. Said Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia. It's gone to the point of parody where the Public Health Agency doesn't promote the public's health. It's a dangerous thing, Offit said. It's the most vulnerable among us who suffer this, and it will be our children who suffer this. And my question will be, will they be held accountable? The policy is akin to malpractice, especially given Louisiana's poor health outcomes, said Dr. Georges Benjamin, the executive director of the American Public Health Association. The U.S. vaccination program represents one of the most important public health interventions that we have, Benjamin added. It's reckless, said Lawrence Ghostin, a professor of global health law at Georgetown University. I think it's a sign of what is about to happen under the second Trump administration. If U.S. senators confirm Kennedy to run HHS, we're going to see the fomenting of public distrust of vaccines, so we lose precious herd immunity, and we're going to see major outbreaks of disease that are fully preventable over the next 4 years. Policy change follows new governor's election. Until becoming Louisiana's governor in early 2024, Republican Jeff Landry served as the state's attorney general for 8 years. During the pandemic, he criticized the state's COVID response and filed lawsuits over federal-state vaccine mandates. On December 6, 2021, Attorney General Landry spoke at a state committee hearing against adding COVID to the childhood immunization schedule. At his side was Robert F. Kennedy Jr., who presented false claims about COVID vaccines. This year, the Republican-controlled legislature passed 5 bills, all signed by Governor Landry, and 2 resolutions aimed at loosening vaccine requirements, limiting the power of public health authorities, and sowing doubt about vaccine safety. Attorney General Jeff Landry speaks about medicine being donated by drug companies during the coronavirus pandemic in Baton Rouge on April 6, 2020, in Baton Rouge, Louisiana. After Landry became governor in 2024, his appointees at the Louisiana Department of Health oversaw a policy that forbid staff from promoting vaccines for COVID, flu, and Mpox. Governor Landry also appointed Dr. Ralph Abraham, a family medicine doctor, to be the state surgeon general. That position co-leads the Department of Health and is tasked with crafting health policy that is then carried out by the departmental co-leader, the secretary. Dr. Wyche Coleman, an ophthalmologist, was named Deputy Surgeon General. At a September 26, 2024 legislature meeting on the state's handling of the COVID-19 pandemic, Abraham and Coleman repeated misinformation about COVID vaccine safety and debunked link between vaccines and autism. I see now vaccine injury every day at my practice from COVID vaccines, Abraham said. Abraham said masking, lockdowns, and vaccination requirements were practically ineffective, that COVID vaccine adverse effects have been suppressed, that we don't know whether blood from people who've been vaccinated is safe for donation, and that we hope and pray COVID vaccines don't increase the risk of miscarriages. Surgeon General Abraham also said there's nothing wrong with Louisiana conducting its own research into whether childhood vaccines cause autism. You could probably fill Tiger Stadium with moms who have kids that were normal one day, got a vaccine, and then were autistic after, said Deputy Surgeon General Coleman at the meeting. Those public comments by Abraham and Coleman are inaccurate and alarming, according to public health experts. Anyone who's articulating that these vaccines are not well tested, they're not safe, they're not effective, is not giving you the science as we know it today, said APHA's Benjamin. To have a top public health officials peddling such scientific falsehoods and threatening the health of their populations, whom they've sworn an oath to serve, almost makes me cry, said Georgetown's Galston. In 3 meetings, surprise and confusion at new policy. The new ban on vaccine promotion represents a new level of political interference. According to 2 current health department employees, we've never felt so unsure of our future. One of them said, why am I here? Why am I doing this anymore? Because you're just so stifled and you are not helping people. Dr. Ralph Abraham, then a member of Congress for Louisiana, speaks at a business event on March 18th, 2019. In Baton Rouge. In 2024, Louisiana Governor Jeff Landry appointed Abraham as Surgeon General, who sets policy for the Louisiana Department of Health. In the October 3rd meeting, Deputy Secretary Dr. P. Grohan, an internal medicine physician, told the state's regional medical directors that they weren't allowed to hold routine fall flu vaccination events, according to a staff member with knowledge of what was discussed at the meeting. These flu shots even had become a key part of the health department's flu campaign in recent years, which included spending over $170,000 annually on outside public awareness campaigns that included paid billboards, bus ads, radio, and social media ads urging the public to get vaccinated for the flu. This year, instead of flu vaccine events, the medical directors were told to pivot to Narcan giveaways. The department's influenza page doesn't appear to have been updated this year. It still promotes events from 2023. The department also appears to have pulled back from vaccination messaging on social media channels. Last fall, it published 6 Instagram posts promoting flu and COVID vaccinations and specific vaccine events. In the last 3 months, the health department's Instagram has had no post about vaccinations and just a single post about flu. The recent post lists preventative measures like hand washing, but not vaccination. That stands in stark contrast to a flu post from the fall of 2020, which stated it's more important than ever to get your flu vaccination to protect yourself and those around you. Regional medical directors are responsible for carrying out the health department's policy and programs across the state. In the meeting, Cohen told them if they want to bring doses of flu vaccine to a local event, they can't use signage or even tablecloths featuring the health department's logo. You cannot ask people, hey, we have flu shots, would you like one? At a community event, according to the staff member with knowledge of the meeting. But if they come up to us knowing we are the health department and say, hey, we hear y'all have flu shots, we can say, yes, would you like one? The medical directors were told because the health department is a government agency, staff are not allowed to coerce people by promoting vaccinations, especially for COVID, flu, and mpox. They have definitely made it clear that we are not supposed to be pushing vaccines at all, the staff member added. There has been no explanation for why these particular vaccines were grouped together. Why on earth would they choose COVID, influenza, and mpox vaccines, which are entirely different vaccines for entirely different purposes? Just shows a lack of sophistication and understanding of science, Ghostin said. I can't think of any reason other than political reasons, said Hood, the former head of the Office of Public Health. Opposition of COVID vaccines has gained momentum within the Republican Party as part of the backlash to pandemic-related public health measures. When it comes to the flu vaccine, Kennedy's anti-vaccination nonprofit, the Children's Health Defense, has made multiple false claims about its dangers. Policy may stem from Surgeon General's letter. At the November 14th meeting, the new prohibitions were relayed to program staff by Tanya Joyner, an assistant secretary to the Department of the Head of Office of Public Health, and Katie McGee, a policy director. Employees were told that Joyner and McGee were relying on the policy because Surgeon General Ralph Abraham could not attend. Staffers asked them what exactly they can say about COVID, flu, and mpox vaccines going forward. They were told acceptable public vaccine messaging should be something along the lines of, talk to your medical provider. That seems to be the catchphrase for all of this, said one staff member with knowledge of the meeting. The secretive rollout of the new policy raised concerns about government transparency and accountability, and a former state employee with knowledge of the state's health policies says it was highly abnormal to deliberately keep the policy out of writing. I'm very surprised that anyone would call a state meeting, not provide an agenda for the meeting, not provide a written set of notes. from that meeting, said Hood. I think that to me, it sounds like people are trying to avoid public record laws. When employees in the meeting asked for the rationale of the policy change, leadership referenced a letter signed by Abraham and Coleman, stating that there is no conclusive evidence that masking prevents the spread of respiratory viruses, and that evidence proving efficiency in prevention of infection and transmissions, hospitalizations, or deaths is far from conclusive for the flu vaccine. That letter provides a template for Louisiana physician to use to get an exemption from the hospital's flu vaccine and masking policies. The letter on Louisiana Department of Health letterhead is not available on the department's website, but was posted on X on November 13th, the day it was mentioned in the meeting. In the letter, Abraham and Coleman also said requiring hospital staff who do not get the flu vaccine to wear a mask was punitive coercion. One Louisiana health professional, not employed by the department, said the letter was crazy. I'm just going to say it. Complete falsehoods. At the third meeting on November 21st, the STD HIV hepatitis program at the department held a staff meeting where more than 80 employees learned of the ban on promoting COVID, Mpox, and flu vaccines. According to 2 staff members, employees were also told the policy would not be put in writing. When staff asked whether the policy applied to hepatitis B vaccines, they were told there was no official response to that yet, said a staff member who attended the meeting. There were so many questions and concerns, the staff member said. A lot of folks were disappointed and just frustrated. A slippery slope to future disease outbreaks. Experts told NPR they feared a policy that undermines COVID, flu, and Mpox vaccinations could have a spillover effect, reducing public trust in vaccinations overall, including those given to children to prevent a host of dangerous and deadly illnesses. I believe that we will see measles cases. I believe we will see whooping cough cases. I believe we will likely see meningitis outbreaks, said Hood. In the November 14th meeting, a staff member asked whether the ban on promoting vaccines applied to children's immunizations, but the answer was non-committal, according to an employee with knowledge of the meeting's details. My understanding was it's not clear to what extent we might be able to promote childhood vaccinations, the staff member said. Nationally, the vaccination rates for serious childhood diseases have been falling in recent years, including in Louisiana. Given those trends, the new vaccine policy in Louisiana is very worrying, said Dr. Joseph Bocchini, a pediatric infectious disease specialist in Shreveport, Louisiana, and the president of the Louisiana chapter of the American Academy of Pediatrics. Earlier in his career, he saw children hospitalized with measles, a dangerous disease that can cause hearing loss, brain damage, and death. I've been a physician for 50 years, so I've seen a lot of these diseases disappear. And they disappeared because of the safe and effective vaccines, he said. The rise of public health officials promoting misinformation. Louisiana isn't the only state where public health officials have recently announced controversial decisions and repeated false or discredited health theories. Florida Surgeon General has made false claims about COVID vaccines, undermined school vaccine mandates for the measles, and said local officials should stop adding fluoride to water supplies. Hood traced Louisiana's new policy in part to Kennedy's ties to Louisiana's Republican Party. Robert F. Kennedy Jr. came to the legislature while I was still in my role at the Office of Public Health to speak out against the COVID vaccine, he said, referencing his December 6, 2021 appearance with Governor Landry. So it's not 100% stunned to hear his influence, was going to be felt in this administration. Louisiana's ban represents an escalation of using vaccine misinformation to direct state health policy. According to James Hodge, a public health law expert at Arizona State University, at Sandra Day O'Connor College of Law. What's very distinct is some sort of official policy advanced and by the State Department of Health saying you may not push and or promote these vaccines at all, Hodge says. That's derelict. It's highly controversial. But it's the kind of policy the nation could see if Kennedy is confirmed as the Secretary for Health and Human Services. Hodge added, in a list he made of possible actions the Trump administration could take, Hodges placed revising CDC vaccination recommendations at the top.